Good afternoon, ladies and gentlemen. Good morning, good evening, in case we have colleagues from other time zones. I thank you, team at IDI, for organizing this forum. And let's start. So my name is Justus Ashaba, as we've heard, and my co-presenter Josephine Kenya may not be able to join right now at start because of another engagement she has, but she may be joining us at any point as we progress. So I'm involved in supporting health information systems and data use and in the health sector in Uganda. And I've also contributed to health information systems and data use in other regions of Africa, where we have managed to support some of the initiatives. And I conduct research. I contribute to research at the Makerere University Health Informatics Research Group, which is led by Dr. Josephine Kenya, who is my co-presenter today. So this time today, we are happy to be presenters at this forum. This forum has been consistently going on every week. We appreciate the organizers for that effort. And here we are today looking at an eHealth evaluation model for assessing eHealth interventions, outcomes, and impact on healthcare. So if I can remember very well, in the past 2 weeks, this forum has had discussions on digital technologies or electronic interventions in the healthcare. And it's good today, we are now looking at, yes, as we implement these digital, electronic, or e-interventions, are we sure they help us to really bring the results we need in the healthcare settings that we implement in? So maybe to start, we are looking at eHealth, which may be a key term. Interventions is known outcomes and impact. We'll see what those are as we progress. So as part of this presentation, I'll go through various sections of this, including some introduction about this topic, the research problem, the questions and objectives of the research we conducted, of course, the methodology and the results. We discuss those results and look at some of the limitations and recommendations for future research. So as we've seen in the healthcare settings, and of course in Uganda and generally in other countries, we see the trend that there is a pressure for healthcare providers to provide really quality and affordable care in terms of all other variables you could think about to make sure that the care is really quality care and it's accessible, it's affordable. So we see there is that pressure and there is that growing trend. And because of that pressure and the need to have such quality care, there is, of course, need for interventions to make sure we achieve that. And such interventions should be helping us in increasing the quality, efficiency, and all other good characteristics that we need in that healthcare. And of course, supporting performance of the healthcare systems. So such interventions have to be in place to make sure that we counteract the pressures and the need. And one of the key aspects that has showed a contribution to improving such healthcare is what we call eHealth. And when we talk of eHealth in the context of this, we will B meaning the utilization of information and communication technologies, be it mobile phones, be it any digital interventions, anything used to manipulate or prepare information and use it, and all other technologies in that line that are used in the healthcare. And healthcare, we are again looking at a wide range of health and its related fields in terms of health surveillance, education, knowledge research, anything that we do in the health sector to contribute to the health of our populations is what we are looking at. And whenever we utilize any information and communication technologies, then we are calling that eHealth. So eHealth of recent has really showed potential to contribute to improving such services, and various governments, various institutions, funders, and all parties have really paid attention, and they have advocated for its use or its implementation to advance or improve these services we provide in the healthcare. And of course, institutions have paid attention. They are implementing and trying to see how do we use these technologies to improve the healthcare that we provide, or the health services that we provide. And when you look at that increase in implementation of eHealth, again, it calls for evaluation of these eHealth interventions so that we are sure that we really get the benefits and results out of these implementations. Specifically, partners and other stakeholders may be looking at how do these tools or systems or these eHealth interventions really help to meet or to achieve the objectives of the health sector. How do they really improve the efficiency, effectiveness, impact, sustainability, and all other variables that may be of interest. And of course, other parties are looking at, is there really return on investment and value for money? Other stakeholders will always be interested to know, yes, we are doing these investments in eHealth and applications, but how do we guide the future decisions and adoptions? So because of this increase in implementation of eHealth interventions, there is a need to really evaluate them and know what do they bring when we implement them. And to evaluate, to assess or to really dig deep into their contribution, it also requires some kind of organized frameworks that will always guide this evaluation. So evaluating such interventions sometimes may be complex, or sometimes may really need to be conducted in a systematic way. So there is need for such frameworks, such guidelines or models to help to understand the eHealth interventions we implement, the environment where they are implemented, and how best to evaluate them. Coming back to Uganda, there is looking at that growing trend of implementing eHealth in various countries and regions. Uganda has also not been left behind, and in line with the implementation of eHealth, developed what they call the eHealth strategy. That was in 2016-17. And that strategy was to guide the nation on really how to strategically implement these applications, these tools, in order to contribute to the health objectives. And in that strategy, it's also very clear that there is need to evaluate these eHealth interventions whenever we implement them, because we need to track their results in terms of outcomes and impact. When we implement them, what comes after their implementation in our health implementations. So again, the eHealth strategy of Uganda recognizes the importance and the need to evaluate these e-health interventions. So as part of this research that we are presenting, after understanding all those pressures, the need to evaluate these interventions, and looking at our e-health strategy in Uganda, guiding that there should be such evaluations, we worked with the Ministry of Health, the Division of Health Information, way back in 2016. And of course, we tried to understand the environment surrounding implementation and evaluation of these interventions. And somehow in the process of interacting and in understanding the environment, we realized there was something not right, which we needed to understand deeply and try to see what stakeholders are doing and what needs to change in order to embrace implementation of these e-health tools, and of course how they can really contribute to the end results that we always expect them to contribute to. So for this research that we conducted, we realized that the e-health strategy told or was guiding that there should be evaluation of these interventions. However, again, we got information that there was no such strong culture of evaluating the e-health interventions that were being implemented in order to understand their contribution to the healthcare in Uganda. And from the information and literature that we really conducted, the literature we conducted and some of the stakeholders we involved, we realized because of this challenge, you realize e-health implementers or stakeholders that implement these e-health interventions did not have much evidence to show how these interventions are really contributing to the health goals. Because in many cases, we implement these e-health tools in order to contribute to some health or healthcare objectives. Implementing these tools is not the real end. For example, if we introduced, let's say, any mobile application for patients to access some service, it's not for the sake of putting that mobile tool, but to make sure that that tool facilitates some other health objectives, either to increase access to care or even to improve how the patients respond to some of the information they receive from health providers. So implementing these tools is not the end, but there should be some results that we realize at the end of it all in our health objectives. So because there is no this culture of evaluating the e-health tools we implement, implementers didn't really have enough evidence to show how the tools and e-health interventions are contributing to the results we intended. And we also realized there is failed adoption of e-health, and sometimes the e-health interventions are introduced but never utilized as such. Then several interventions have also remained as pilots without really much effort to scale them. And sometimes we've also seen others not being sustainable, and various other e-health interventions in the country, which is Uganda, are run independently in silos, not contributing to the objectives of each other, and sometimes that has also been a challenge. And when we look at that problem that is in the center, somehow we also understood that even though we have these various e-health interventions implemented in the country, most of the implementers had implemented without much guidance from either the Ministry of Health or that eHealth strategy. And there was again no framework that was really guiding eHealth implementers in the country to evaluate these interventions. So that's some kind of summary about the problem, which we understood preliminary from the engagements we had. And in details, when we decided to conduct this research, we wanted to understand, okay, we've seen there are various implementations and there seems to be no evaluation going on, and implementers may not be having enough evidence to really show what these eHealth interventions are contributing. So we wanted to understand how best eHealth interventions in Uganda can be comprehensively evaluated. And specifically, we wanted to understand the practices and measures in place, how the implementers are currently implementing the eHealth interventions and, of course, evaluating them. We wanted to understand the challenges they were facing in implementing and evaluating. And after understanding what was taking place, we also wanted to understand, yes, if we had better evaluate these interventions, what dimensions or the scope of a model that would guide such comprehensive evaluation. And of course, when we talk of evaluation and assessments, we also wanted to see what indicators or areas that we will really look at and measure to see that these interventions are contributing or are giving results. And we also wanted to really bring clearly the guidelines that should be considered to aid the comprehensive evaluation of these interventions in Uganda. And with those questions, the objectives of the research were in line with the questions, so that we will get to answer those questions. In terms of the methodology, being a research looking at the eHealth interventions, of which these eHealth interventions are some developments and implementations, which in the other side of information systems, we may call them we may call them design science. We employed a methodology that would help us really look at those eHealth interventions in the perspective of design science, because these are tools that are designed to work for the people, to be used for the people. And of course, we would again put that in the context of the settings where the eHealth interventions are implemented. So in terms of the research strategy, this was more inductive, where we are trying to really understand and explore what was going on in order to later design what we wanted to see as a mechanism of comprehensively evaluating these tools. So the design science research methodology that we applied guides on some of the steps we have to take care of in order to conduct research in these areas. And of course, looking at this upper area here, it guides us on these steps that we always need to identify the problem, and of course, motivation for conducting the research, which is what I gave a background on as the problem that is existing, and of course, defining the objectives of what you are trying to work on, or the solution that you are trying to design. In this research specifically, understanding how to evaluate the eHealth interventions, what we are developing or designing is the eHealth evaluation model, which will at the end of it all guide implementers in this evaluation. So that eHealth evaluation model is the design output that will come out of this research. And as a way to develop it, these are the steps that were conducted, or the various stages we went through in order to develop or design that eHealth evaluation model. So we understood the problem, we defined the objectives of this research as we looked at, and of course, artifact design and development, which is the actual process of now developing this model. And another step is demonstration, making sure that after this model is developed, it's given out to stakeholders, to experts who can really either challenge it or contribute to its improvement. And then it's validation and making sure that it's performing as we expected, and communication about what has been designed. So in that line of stages or steps that we went through to design this model that we are talking about, each of these steps, of course, would help us to achieve some of the objectives we mentioned. For example, in the area of identifying the problem, where we reviewed literature and we conducted a cross-sectional survey, as we will see, we achieved the first and the second objective, where we understood the practices and the measures that are currently in place on how the stakeholders that are implementing these eHealth interventions are using to evaluate their contribution. And also we understood the challenges that they were facing in doing that practice. And then the stages 2 up to 3, they helped us achieve the objectives, where we wanted to define the scope and what would be entailed in the model that we were developing. So in terms of defining its objectives, developing it and demonstrating it to stakeholders and experts, we got to define its scope, understand the indicators that had to be in that model, or the indicators that would guide evaluation of the eHealth tools we are talking about, and of course also develop some kind of guidelines that implementers would follow if they are to really evaluate their eHealth interventions well. And then the last 2 stages of that methodology, which is validation and communication, we are in that area trying to interact more with now the experts and stakeholders to make sure that they really test the model and confirm if it was really helping us to comprehensively evaluate the eHealth tools we talked about. And of course, then from there, we also communicate it to various stakeholders widely to make sure that it's either used or even more contribution comes in. And in such validations, we again followed specific validation criteria, which is very specific to design science research, which is specific to designing such frameworks of that nature. In terms of the settings where we conducted the research, we were closely working with the Ministry of Health Division of Health Information way back then in 2016. And in that way, they guided us on which participants and stakeholders to engage. And we reached out to 18 institutions that were considered very, very key in implementing eHealth in Uganda. These are institutions that in their work, they were implementing such eHealth or ICT technologies in delivering their services in the health sector. And in those 18 institutions, I remember even IDI was part, we reached out. We managed to interact with 22 participants who were again involved in implementation, evaluation, and use of such eHealth tools. These institutions were guided, their selection was purposive, being that we were guided by MOH, as these were the institutions involved in implementation of eHealth. And in the 22 members we interacted with, 17, which is the majority, was male, and we had some other percentage of females. And these members we interacted with were from varying roles, in that others were program managers, others monitoring and evaluation officers using these tools, health informatics specialists, software developers, statisticians, and IT systems administrators. So we managed to interact with a wide range of stakeholders who were playing different roles in implementation of these eHealth interventions. So in terms of results after applying that methodology, in terms of the results we got, the results are broken down into the various stages and the various objectives. For example, in the first stages where we wanted to understand the practice and how implementers were conducting these evaluations of their eHealth tools, and getting to understand if there were any challenges they were going through, we conducted a cross-sectional survey, which I briefly described how we conducted it. In this survey, what we understood from the survey was that there were various interventions implemented in the country, because all the various implementers and even information from the Ministry of Health showed us that there are really very many digital, electronic, or ICT tools in place, which stakeholders were using to provide services in the health sector. And something else that came out clearly in the survey was that these implementers, let's say if an institution like IDI or even different hospitals or other partners of Ministry of Health, whenever they would implement these eHealth tools, they would really focus on monitoring the functionality and adoption of these tools. Functionality would be that, okay, if I've implemented my technology, of course, to deliver some health service, they would really make sure that that platform works. Working means if it is to help someone communicate to a doctor, it's doing it. If it's to deliver some maybe orders from some facilities to Ministry of Health, it's helping the hospitals deliver orders. So implementers would focus at that functionality and adoption if whoever they wanted it to use it has used it, and they would stop there. That is more of monitoring how the eHealth interventions have been used or their functionality. And the other part of evaluating their outcomes and impact was not being paid attention to. So when you look at monitoring functionality and adoption, that's like, yes, we've implemented this intervention, people have used it, and it's helping them to do what they are intended to do. But then the question is of, yes, after using this intervention, what has it changed in our health indicators or in the health characteristics that we are trying to improve? Such questions of the results of that implementation were not being paid attention to. And that's the area that we call evaluation. And something else that came out clearly was that there were no national guidelines for digital health or eHealth implementation and evaluation. So partners and implementers were implementing sometimes with guidelines or not, but at least everyone would try to implement their best way without some centralized guidance from the national level that they were following, especially in the evaluation of these tools. So looking at some of the indicators that we found out implementers were monitoring, whenever they would implement these tools, they would look at such indicators or areas where they would really measure progress. They would look at system availability, response speed, if the system is working, functionality, how people are using it, and some of these indicators, which when you look at them critically, you realize they are all focusing on the functionality or the functioning of the system. And then in terms of challenges they are facing, some of the challenges that came out clearly is limited evaluation skills and capacity. Yes, in that the part of evaluation participants or implementers were not really having the required skills or even capacity in terms of knowledge and other tools to use. There are no standard procedures, especially at the national level, for guiding these performance evaluations of eHealth, and even interventions were not very much documented on how they are working and how they would contribute to results, the main results of the health sector generally. And sometimes other stakeholders would be having negative attitudes and other various challenges, but challenges that were that featured more frequently were around limited capacity and skills and not having guidelines to follow in implementing and evaluating these interventions. So that showed us that yes, as we implement, there is more of monitoring than evaluation of what comes after when we implement these digital health or eHealth interventions. So that, of course, confirmed the problem that we talked about, that there is no that culture of evaluating and questioning or coming back to see how have these interventions contributed to our main health goals. So after looking at that challenge and the challenges mentioned where people didn't have capacity and skills and knowledge and of course lacking guidance on what to do to evaluate, that gave us a go-ahead to now try to develop a solution which we are calling the eHealth evaluation model that would then help to guide on how to do these evaluations. Whenever we implement eHealth or digital health or ICT tools in the health sector, how should we monitor their implementation, but also evaluate the outcomes and impact, which is the results of their implementation. And in order to contextualize this model that we developed, we had to look at various literature and other documentation. And in that way, that cross-sectional survey we conducted already gave us some information on how the implementers were suggesting that these evaluations be conducted. We also looked at various other evaluation models in literature, and we also looked at what we call results-based management, and also looked at what World Health Organization guides on eHealth monitoring and evaluation. Specifically, World Health Organization provides those key questions that we should ask ourselves as we implement, monitor, and evaluate these interventions. So we understood all guidance from such areas, and my screenshots here may not be clear, but what we see as all the suggestions and feedback we received from the survey on what should be considered in order to really evaluate these eHealth interventions. And then here B, all these And then for C, which is the results-based management, it also guides on how we should look at results whenever we implement any activities or interventions coming from program inputs and activities where we are really implementing, and then going to results where we are looking at the outputs, which are the immediate changes that come out of our implementations, outcomes and impact, which are more of long-term results that result from our interventions. So for example, when we develop and implement an eHealth platform, let's say we are trying to collect some data about some health indicators, and we've put in place a platform that will collect that information. So that is more of implementation. We've put whatever is necessary to put the platform in place. Yes, it's working. But after it has worked, then we try to look at the outputs and outcomes that come out of that implementation. That's what the results-based management strategy guides. And also World Health Organization that was guiding on some of those key questions to ask if the technology we have employed is working, and then if it's working, yes, how are the people interacting with it? What feedback do we get from the people using it? And then if assuming everything was fine, it was working, people are using it well, we still have to question how has that technology improved service delivery and all other health indicators that we are looking at. And then, of course, later we also need to know how has such improvements in service delivery contributed to the health outcomes that are like the end results. So looking at how has the health of the people improved. So looking at all those areas that we consulted, we derived what we called the reference model domains, which constitute the main areas that we would look at when conducting monitoring and evaluation of those eHealth interventions. And such domains ranged from technological issues, organizational issues, legal and ethical, human, user coverage and transferability, cost efficiency, quality and utilization, and of course, the health outcomes. So these are the areas that, after consulting all the different knowledge sources, we are now bringing together to try to put some guideline that now become domains of the eHealth interventions. And looking at just one domain like technological, there are again various breakdowns on when you are at technological aspects, what do you have to look at, all those details of system response time, availability, reliability, system technical support availability, the hardware, the standardizations, the interoperability, because interoperability is very, very important in that when there are various eHealth tools, sometimes, or in many cases, they have to really contribute and work together to a common goal. Various technological aspects have to be looked at. So that's what was coming from the literature. Again, World Health Organization at technological issues, what does it guide? And then from the survey we conducted from eHealth implementers in the country, what were they guiding about technological issues? So when we look at all those sources about each domain, then we came up with these concrete and comprehensive aspects that in our model, we guided that they should be paid attention to. So this detailed analysis was done for each domain in order to come up with the models and in order to come up with the domains and subdomains that have to be paid attention to. Then from getting the domains and subdomains, we also designed what we call the reference model that would be a high-level guideline picture that shows you when you are trying to do monitoring and evaluation of eHealth, what are those aspects that you should consider. So this gives us a view of the whole cascade of results from implementation up to the results we expect. And we had to make sure that this model really caters for all the details we understood from literature, other institutions, and from World Health Organization, and feedback we got from the cross-sectional survey. So we see that, if I can go through it quickly, the reference model here guides us that, yes, as we are doing our eHealth interventions implementation, if we've really got the need and we have developed this tool and it's in place working, we always have to really ask ourselves if the eHealth technology is working. And in order to really answer such a question and know if it's working or not, we have to pay attention to such domains. We look at the needs assessment. Of course, you wouldn't really design a tool without a needs assessment. Then we look at details of functionality and all other aspects as they are shown here. After looking at those aspects that help us to answer the first question, we also look at the outputs. How do users interact? So this is more of feedback from the people using the tool. What responses are they giving? How is it being welcomed or received by users? To what extent has it covered your target groups in terms of coverage, representativeness? If you're targeting different categories of participants to use the tool, how representative have all been involved in using it? And then after they have used it, we come back to look at areas of our healthcare or the service we are providing. How has the utilization of such a tool affected the efficiency, quality, utilization, quality, and all other aspects you may want to measure about the service you are providing. Then once we go through such evaluations of looking at the effect of the tool or the eHealth intervention to these aspects of service, then we go ahead and ask ourselves if we have got either improvements or whatever results we've got from the service aspects, how has it contributed to the general health outcomes that we always all work towards? And these are high-level results that we always achieve after long periods of implementing interventions, looking at things like disease burdens, disease mortality rates, and other aspects like health equity. So we are looking at a cascade from implementations up to the time when we really pay attention to the contribution of that tool to such high level and long-term objectives of our health interventions. So that's what the model guides, that we should pay attention to all those stages of results. And in order to really guide the utilization of the model, we also looked at some of those indicators that could be paid attention to at each domain we mentioned. For example, if we talk of functionality, what do you have to look for in that eHealth intervention? You have to look at the extent to which the functionalities and requirements that you specified at start are met by that technology you've applied. When we talk of standardization, what specific indicators do you have to measure? And of course, these are some of the tools or sources of information where you can get that information. And of course, different interventions are implemented in different contexts. So again, contextualization has to happen. And because we brought about the eHealth evaluation model, the reference model, put then the indicators. We also had to put what we called guidelines, which are like a step-by-step procedure on how can implementers utilize the model in order to go through an evaluation of a specific tool. After developing all those three components of the framework, we did what we call the validation, where we again brought together 21 eHealth practitioners, again from different institutions and different domains, to give feedback and guide about the utilization of this model that we developed. Feedback showed most of the practitioners were really in agreement that the model was performing well in terms of these areas. Again, we looked at, which are more of design science evaluation criteria, looking at the effectiveness of the model, efficiency, completeness. So basically looking at, can this model be utilized to do what we intended to do? Can it really save time? Can it be easy to use? Can it be easily understood by practitioners? Is it contributing to knowledge in the information systems domain? So all those criteria, most of the criteria, we see that practitioners agreed that the model was meeting these criteria. And in terms of discussion, or a summary of all those processes we went through, we clearly see that literature told us that there are several approaches to eHealth evaluation. However, those existing literature that we looked at were not clarifying about monitoring and evaluation, of which was the issue in Uganda. In Uganda, people were doing more of monitoring, not paying attention to evaluation, yet evaluation is very key. And there were no guidelines by that time to really guide how best to conduct the whole cascade of monitoring and evaluation. So the existing models by then could not apply to our situation, where we needed that clarity on what to do in order to comprehensively evaluate. So that model that we developed, as I mentioned, contains three main products or aspects, which is a generic reference model, the indicators to measure, and the guidelines to follow when utilizing that model. And from the validation, we've seen that most of the, we've seen high acceptance by the stakeholders we engaged. And of course, that high acceptance, where stakeholders are saying this model can be used in Uganda, also suggests other law and with much modification. I see time is really against me, but in order to, as a summary, I think we've gone through this summary. Maybe as limitations during this validation, when we developed this evaluation model, the way we validated it, we demonstrated it to the experts we worked with. So we did not really use this model to evaluate a real system in place or in implementation. So that kind of validation or verification of the model we developed may not be the best, but we would also want to apply it in real life settings so that we use it to evaluate a specific eHealth implementation, and then we get to see how exactly it can facilitate that process. And that is one of the recommendations, that we recommend the application of this evaluation model in the different eHealth interventions in Uganda, so that we can get to see how best it can facilitate the real life setting, not just demonstrating it. And of course, for any research that can be are conducted again in line with this. We could also assess if the model can also be applicable and useful in context of development countries. From the research, we've got 2 manuscripts, of which one is already published and one is under review. And of course, as part of the dissemination, this forum has also really done good, so that we communicate to you what we did and we get feedback from the session here. Thank you very much. I think I've not been a good timekeeper, but I hope we can use the last 5 minutes to interact. I welcome your feedback. Over to you, Chair.